So the first area then is the forehead. So we have one muscle either side of our forehead, and we'll ask Leah to raise her eyebrows up, and that's what those muscles do when they contract. So they elevate the eyebrows, and in doing so they create these little lines, sometimes referred to as worry lines, across the forehead. Leah's are very faint because she's quite young and doesn't need Botox, but this area is certainly one that is amenable to treatment with Botox. So the next area then is the glabellar complex, commonly known as frown lines or 11s because of the orientation of the wrinkles on the surface of the skin. So we have three main muscles involved, one either side here that pinch together and one in the middle that pulls down. So can you do an angry frown for us there, Leah? And again, Leah's lines are very faint as she's quite young, but as we get older, they become more pronounced. And again, this is another area that's amenable to Botox. And as you can see, frown again hard as you can. When you frown, you pull down the inside of the eyebrows, which is something important to note. So the third area that's commonly treated is this lateral canthal area or crow's feet region. So you give us a really big smile there, Leah. Leah has, again, very few lines, really doesn't need any treatment. But as we get older, these lines become more pronounced, like so. Okay, again, this area is very amenable to treatment. And can you close your eye first, Leah? So this is also the muscle involved. So as you can see, when Leah closes her eye, it pulls the tail of the brow down. Okay. Next area then is this little area on the side of the nose. So can you scrunch up your nose first, Leah? So these lines are commonly referred to as bunny lines. There's multiple muscles involved in forming these lines, but again, they are amenable to treatment with Botox. The under eye region can also be treated with Botox cautiously and in certain specific indications. So we'll move on to the lower face then. I think an important distinction between the muscles of the upper face and the muscles of the lower face is that the muscles of the upper face are really involved in animation. So if they were to be overtreated, the only thing that will happen is that you will lose a little bit of animation, okay, which, while not ideal, is not catastrophic. In the lower face, these muscles are also extremely important for function in terms of eating, chewing, talking, etc. So there is a maximal amount of Botox you can put in the lower face to ensure that you don't disrupt function of the muscles. So some of the areas you can be treated are a gummy smile treatment, the area around the mouth, the chin, and what we call a little muscle here that pulls down the corners of the mouth. So I'll go into them in a little bit more detail now. Okay, so first of all, can you give us a big smile, Leah? Big cheesy grin. Okay, so in Leah's case, she doesn't have excessive show of the gum, but some people have what is referred to as a gummy smile, whereby they show an increased amount of gum as they smile. So injecting a little bit of Botox either side can have a really nice impact on that. Okay, again, in Leah's case, while she's quite young, she has very few or little dimpling of the chin, but as this worsens with age, we can inject a little bit of Botox into this mentalis muscle either side here and here to reduce this effect. Okay, so as we age, the corners of the mouth tend to turn down due to, in part at least, by overactivity of a muscle here, which is called depressor anguli oris. As the name suggests, it depresses the angle of the mouth. So if you do a sad face for you, Leah, so you can inject this muscle either here or lower down, and again, that will help improve this feature and bring us back to a more neutral or upsmiling appearance. So again, in Leah's case, she has no lines around the mouth, but should she have little smoker's lines or barcode lines develop, we can inject a number of places in the top lip and bottom lip, which can help with these lines. And equally too, by injecting this area, we can increase the amount of lip show, which is commonly referred to as a lip flip. Less commonly then, you can use Botox in the nose, for example, into a little muscle centrally here, which pulls the nose down. So by injecting it and relaxing it, you allow the nose to move up a little bit. Or equally too, you can inject either side of the nose to reduce flare of the nostrils. But it's not a very common indication, and there's probably better treatment options out there. So another very common use for Botox into the face is to reduce grinding. So this muscle here, masseter, together with the temporalis muscle up here, are responsible for chewing and grinding. People who tend to grind their teeth a lot can damage the enamel of their teeth, and also a side effect of grinding continually is that the muscle will hypertrophy or increase in size and widen the lower face. So by treating this area with Botox, you can slim the lower face, which is aesthetically desirable in a lady, and equally too, you can reduce the pain associated with tooth grinding.